Okay, well, it's 11 o'clock in the morning here in beautiful sunny Shelby Township, Michigan. So we'd like to welcome you to our Facebook Live video of the Orbera gastric balloon insertion with our friend Shauna here, who's going to be drifting off to sleep momentarily as we kind of give you some of our introductory remarks. Now, it may be freezing outside right now, but before you know it, it's going to be spring break time and then summer vacation. And so a lot of people this time of year, you've just had a great time over the holidays, maybe had a little indulgence in the food department, and you're looking for some help in getting some of the weight off. Well, the Orbera gastric balloon device is exactly what that is made for. It's a silicone balloon filled with saline, which goes inside of the stomach and basically occupies space so that it helps you lose weight. It's a tool that will help you feel full much sooner. So you have a small meal, makes you feel very satisfied, and decreases your caloric intake in general. This is kind of a model, a replica, that would simulate, though the sizes are a little bit different, it kind of simulates the size of the balloon within the stomach itself. Now, as Sean is drifting off to sleep, we'll talk just a little bit about it. We happen to have 2 balloon removals today already, and both of those patients had lost 35 pounds in just 6 months. So we look for patients who are looking for some weight loss. We say on average they lose 20 to 40 pounds. We've had patients lose as much as 100 pounds. And it all is based on the device being in place, follow up with our Allure medical weight loss team, including our dietitian, Shayna, who meets with our patients regularly. As a bariatric surgeon, a lot of patients have come to me in the past saying, you know, I'm looking for something non-surgical. And so that is, by using this device, it's allowed me to perform a weight loss procedure on a patient without altering their anatomy. Or say perhaps you don't qualify for weight loss surgery because your body mass index or weight isn't qualifying. Well, again, another perfect indication for this. Now, Shauna's already drifted off to sleep, so we're going to get started with our procedure. And it starts basically with an endoscopy that we look down into her stomach, basically make sure the coast is clear, that there's no issues that would prevent us from doing the operation. So I'll take the scope now and the bite block, please.
Bite block scope.
Okay. I'll be kind of talking through it as we go. And help us get that in there. I'll have you guys work on getting that in there. You can turn on our scope as well. So it's a sedation procedure, kind of like a colonoscopy or something like that. Not completely asleep. So you may see her move around, maybe even make noises, snoring perhaps, sometimes hiccuping. And as we get the bite block in place, that's just to basically protect the patient's teeth and protect the scope as well. As far as the Apollo Orbera balloon goes, now this balloon has been around the world for over 15 years with 277,000 devices placed. So even though it's new to the United States in the last 2 years, it's been around the world for over 15 years and very safe as well. Okay, we have our bite block in place. We're going to turn our light on our scope and we're going to begin the procedure.
Can you turn the pump up, please? Pump off?
On. Mm-hmm. All right.
And suction.
So you look into the back of her throat. And as we're going down the esophagus, which is the food tube that goes from the mouth down into the stomach, we get to the bottom of the stomach, and now we look inside. Like I said, hiccups is common. We look for other issues that may prevent placement of the balloon. Her stomach looks appropriate for placement, so we'll get started. Now we're looking inside of the stomach. You can see on the monitor that we're looking back onto the scope itself. So we just check out the entire stomach, make sure everything looks okay. And it looks great. So at this point, we're going to insert the balloon. The balloon starts out as a non-inflated device, about the size of your ring finger. So it easily goes to the back of the throat. And then what we'll do once we get it beyond the throat, we'll then follow it in as well. Okay, we'll take the scope. Thank you. And now if you can see on the monitor, we have the balloon partially down the esophagus. And now we're going to follow it into the stomach with the scope to be sure it gets into the right location. I think it's really important with these devices that you take a look inside the esophagus and the stomach. So it's nice that we can do an endoscopy prior to the procedure to make sure that everything is clear and ready for the balloon to go into place. Hiccuping is very common during the procedure, nothing to worry about. So as I mentioned, it's a sedation procedure, not a completely asleep procedure. So making noises and movement is quite normal during this portion of the procedure. So now we see the balloon is comfortably in place in the body of the stomach, and we're going to start to inflate it now. Yep. We're connected to our pump. Now the pump makes a little noise as it's inflating. And then we're able to monitor and watch the balloon as it inflates within the stomach. Okay, we're going to activate our pump. If you can just step on that, we'll go up to 600. So you can start to visualize the balloon as it's expanding within the stomach. You see it start to fill with fluid. And the whole procedure in general takes about 10 minutes, as you'll see, starting with the sedation, to full inflation of the balloon, to the end of the procedure. See the balloon filling in place here. Okay. I'm going to stop at about 580. And we're almost completed with the balloon full. All right, the balloon is now full. We easily remove the catheter. You can take that for me. And here we have it now, the balloon in place. Just take a quick look inside the stomach. You see the balloon is comfortably resting within the stomach. Plenty of room to move around. You can even get beyond the balloon. But as you can imagine, it takes up space within the stomach. It's about the size of a grapefruit. So you get full much faster. And it keeps you satisfied for a lot longer. So essentially, that's the procedure. Some other questions people may have. Have we had any questions yet from the crowd?
So that sound she's making, is that hiccuping?
Yeah, that's the hiccuping. Basically, the noise she's making is just like any hiccup. With the sedation, sometimes that induces that. So it's like any other normal hiccup.
How long does the balloon stay in?
The balloon is a great question. So the balloon stays in for 6 months, which gives you time to work with our Allure Medical weight loss team and Shana, our dietitian, as we kind of rechange and redirect our relationship with food, so to speak. Frequent visits throughout the balloon duration is really what we show to be most beneficial for the patient's weight loss.
How many balloons have you performed?
So me personally, I've performed over 200 balloons. I work with the Apollo team and the Orbera team as the proctor throughout the country. So I'm able to travel throughout the United States, coaching and instructing other surgeons and gastroenterologists around the country in the insertion of the device. So I've trained the majority of the practicing surgeons in the United States right now as far as the Orbera goes. As I mentioned, we've had 277,000 throughout the world at least. Some other things we want to talk about basically. Now with the weight loss season in full effect now, we want to do something for our patients. So because this is such an effective device, we wanted to offer a discount for our patients. And so throughout the month of January, we're offering $500 off of the price. And we look forward to meeting you when you come in for the consultation, where we can talk more about the procedure in general and that type of stuff.
We have a few more questions.
Oh, great, more questions.
Dan Costa on with us, and he has a question regarding how does the balloon feel when it's inside?
So some people will notice, the question, just so I can reiterate that, was how does the balloon feel when it's inside? Initially, some patients will notice the balloon, but it then becomes part of you. And so it feels very natural. In fact, most patients will say that they don't even know that it's in place after the first few days. Some nausea after insertion is common for the first few days. Thereafter, it's very well tolerated. But we give you medications to make sure you're comfortable after insertion.
And what does the BMI have to be for a balloon to be inserted?
So the FDA requires that the BMI is between 30 and 40. For people who are outside of those limits, we can sometimes make special exceptions. So we'll talk with you about that at your consultation. So if you think that this device is appropriate for you, it's definitely worth coming in to talk. Even if you're outside of those BMI recommendations by the FDA, we've done it very safely in other patients as well.
How long will they be off work for?
That's a great question. So someone asked, how long will you be off work? Well, some people, we usually do our procedures on Friday, like today. And with that, we are allowed to have patients recover over the weekend. And most patients don't have to miss any work. So maybe Friday, you come in for your procedure, and you're ready to go back to work on Monday.
And then Susan wants to know, how long does the procedure take?
Yeah, so the procedure on average takes about 10 minutes. By the time we get you sleepy, sedated, we insert the balloon, and then complete the procedure all within 10 minutes. So there's essentially no downtime, no pain associated with it, and very well tolerated. Again, all for the benefit of 30 to 40 pound weight loss on average, though we've had people lose a lot more as well.
And Leslie's here with us. She would like to know, is there any possible side effects with the balloon?
So people asked about side effects. Side effects after insertion, maybe the nausea, sometimes vomiting. But otherwise, in general, it's very durable. There's nothing that you can swallow or eat that's going to harm the balloon. It sustains all temperatures. You can fly on an airplane. You can go through an airport security device and it's not spotted. We've even had a husband and wife team who were having competing weight loss, and the wife did not tell her husband she had the balloon inserted. We're not going to tell you who that is, but it's that easy to insert, very minimal downtime, and a lot of people don't even know that they've had it done. If you guys want, you can take her to recovery if you'd like. Yeah? So we'll continue to answer questions here as we receive them from the crowd. One thing I certainly want to discuss is our webinar. Our webinar we have coming up on January 18th from 11 a.m. till noon. And so that is going to give us an opportunity to do a full slideshow to talk to you more about the contraindications, the indications, the benefits, our follow-up program. And that's an hour-long webinar where you'll also be able to ask questions. And so that's January 18th. Mark your calendars from 11 a.m. to noon. The way you can register for this, which is very important, is to go to the Allure Medical website, which is alluremedical.com. Then there'll be a tab for drop-down. You want to go to the section that says News, N-E-W-S. In that News section, you scroll down, and you'll see registration for our webinar. By clicking on that, you will then be taken directly to the registration page where we'll be going through the presentation. Most importantly, I think it'd be great if you came in and saw us. If you're looking for a weight loss solution, this is certainly one of the best products out there on the market that allows for a minimally interventional device that's going to help you feel full, stay satisfied for longer, give you the jump start that you're looking for. We also on our website have some testimonials from previous patients who you can listen to, and they'll be able to, by just kind of hearing their story, will be great for you as well. I think very beneficial.